Imagine this scenario. You go to the doctor with head pain and symptoms of chronic illness. After initial diagnostic questioning, your doctor refers you to get a brain scan in a 7T MRI facility. You ask yourself, what is this new technology? Is it the same amount of discomfort as previous MRI scans? As a newer technology, the 7 Tesla 7T MRI is a critical medical imaging device utilized by doctors to help diagnose patients with a myriad of serious conditions, especially those who require intensive brain scans. Based on the rising usage of the 7T MRI, Bioengineering Team 15 is focusing on the development of a novel noise attenuating earpiece to ensure safety and comfort of patients who are required to undergo 7T MRI brain scans. Due to the technical advancement of this MRI machine, head coils for 7T MRIs are tighter than other head coils for other MRI machines, rendering more precise images. However, this also renders most hearing protection useless, as over-the-head headphones do not fit inside the helmet-like device. MRI noises are loud and can induce anxiety, and current designs fall short in creating a snug fit that adequately provides strong communication between MRI tech and patient, as well as noise attenuation. We interviewed numerous doctors, nurses, and MRI researchers with clinical experiences, such as the Magnetic Resonance Research Center, MRRC, the University of Pittsburgh 7T MRI Lab, and others. Through our ethnographic research, we found that this aspect of MRI noise attenuation is a significant unmet clinical need. Some of our primary requirements for our design included materials for proper, adequate noise attenuation, material ear interface comfort, and cleanability ease. We developed low-resolution prototypes and conducted killer experiments to determine our final design. One major constraint we had was accounting for the lack of space between the patient's head and the head coil. Between the patient and the head coil is an inflatable device called a multipad that stabilizes the patient's head. Our device has to fit within these specific size parameters, which was one of our main killer experiments. We identified several hazards on the device and its use. For instance, we cannot incorporate ferromagnetic materials, such as certain metals, into our design, as it will interfere with the magnetic field produced by the MRI and cause objects to fly into the bore of the machine. In addition, since there will be an ear tip that's inserted into the patient's ear canal, it is important to ensure that no material protrudes too deep into the ear and causes damage to the eardrum. Further, a 7T MRI scan can create sounds between 120 to 130 decibels, a level that can create permanent hearing damage immediately after exposure. These are large concerns that must be carefully controlled and mitigated. The killer experiment of talking with our mentors at the 7T MRI lab have led to the selection of one prototype direction: the creation of a noise attenuating headpiece that fits inside of the 7T MRI machine and fits into the constraints of the inflatable multipad. It will be made out of various layers of noise attenuating materials, such as silicone for the outer layer of the device, cork for the noise absorbing, neoprene foam for comfort, and silicone foam or polyethylene foam for noise blocking. We plan to conduct verification testing by placing the device over a model ear containing a microphone and playing pre-recorded MRI audio. We'll be able to compare the noise attenuation of our device to commonly used ear tips. We will also conduct validation testing with the 7T MRI lab to verify that the device fits comfortably on a patient while inside the lab's proprietary head coil, conducting test protocols that proves the usefulness of our device.